Hi viewers, now that we know what cancer is, let's get to the causes. What actually causes cancer? Cancer is caused by changes, mutations, to the DNA within cells. These changes can disrupt normal cell function, leading to uncontrolled growth and the formation of tumors. The causes of these mutations can be genetic, environmental, or lifestyle-related. Here's a breakdown of the main causes. 1. Genetic factors. Inherited mutations. Some people inherit genetic mutations from their parents that increase their risk of certain cancers, e.g., BRCA1 and BRCA2 mutations in breast cancer. Family history. A family history of cancer can indicate an inherited predisposition. 2. Environmental exposures. Radiation. Exposure to ionizing radiation, like X-rays or radioactive substances, or ultraviolet, UV, radiation from the sun can damage DNA. Carcinogenic chemicals. These include substances like asbestos, benzene, formaldehyde, and certain pesticides. Pollution. Air pollution and exposure to harmful chemicals in the environment can increase cancer risk. 3. Lifestyle factors. Tobacco use. The leading preventable cause of cancer, strongly linked to lung, throat, mouth, and other cancers. Alcohol consumption increases the risk of cancers of the liver, breast, colon, and more. Diet and obesity. Poor diet and obesity are linked to various cancers, including colorectal, breast, and pancreatic cancer. Lack of physical activity. Sedentary lifestyles contribute to weight gain and increase cancer risk. 4. Infections. Viruses. Certain viruses can cause cancer, such as human papillomavirus, HPV, cervical, anal, and other cancers, hepatitis B and C, liver cancer, Epstein-Barr virus, EBV, lymphoma and nasopharyngeal cancer, human immunodeficiency virus, HIV, increases risk of several cancers. Bacteria and parasites, e.g., Helicobacter pylori infection is linked to stomach cancer. 5. Hormones and immune system conditions. Hormonal imbalances, natural or from hormone replacement therapy, can promote some cancers. Weakened immune systems, e.g., from HIV/AIDS or immunosuppressive drugs, increase cancer risk. Susceptibility to cancer. So now, who is susceptible to cancer? Susceptibility to cancer simply refers to how likely a person is to develop cancer based on a combination of genetic, age, environmental, and lifestyle factors. Some people are more susceptible than others due to the following. 1. Genetic susceptibility. Inherited gene mutations. Some people inherit mutations that increase their cancer risk, e.g., BRCA1, BRCA2 in breast and ovarian cancer. Family history. A strong history of certain cancers in close relatives may indicate an inherited cancer syndrome. Genetic syndromes. Lynch syndrome, colorectal, endometrial. Li-Fraumeni syndrome. Multiple early onset cancers. 2. Age. Cancer risk increases with age as DNA damage accumulates over time and the body becomes less efficient at repairing it. 3. Gender. Some cancers are more common in one gender. Prostate cancer in men. Breast cancer in women, though men can get it too. 4. Environmental exposure. Regular exposure to carcinogens, like tobacco smoke, asbestos, or UV radiation, increases risk. People living in areas with high pollution or industrial toxins may be more susceptible. 5. Lifestyle factors. Smoking, alcohol, diet, obesity, and lack of exercise can significantly influence cancer susceptibility. Long-term behaviors have cumulative effects on risk. 6. Infections. Chronic infections with certain viruses or bacteria, HPV, hepatitis B, C, H. pylori, raise the risk. 7. Immune system function. People with weakened immune systems, due to HIV, medications, or transplants, have higher susceptibility to certain cancers, such as lymphoma or Kaposi sarcoma. 8. Hormonal factors. Long-term exposure to hormones, like estrogen or testosterone, whether natural or from hormone replacement therapy, can increase risks of hormone-sensitive cancers. Let's get to the risk factors. Cancer risk factors are characteristics, conditions, or behaviors that increase the likelihood of developing cancer. While some factors can't be changed, like age or genetics, many are modifiable. Here's a categorized overview. 1. Lifestyle-related risk factors. Tobacco use. Causes. 30% of all cancer deaths. Linked to lung, mouth, throat, bladder, and more. Alcohol consumption. Increases the risk of cancers of the liver, breast, mouth, throat, and esophagus. Unhealthy diet. High in processed red meats. Low in fruits and vegetables. Obesity and overweight. Increases risk of 13+ cancers, including breast, colorectal, uterine, and pancreatic. Physical inactivity. Linked to higher risk of colon, breast, and endometrial cancer. UV radiation exposure. From sunlight or tanning beds. Major risk for skin cancers, especially melanoma. 2. Environmental and occupational exposures. Radiation exposure. From X-rays, radon gas, nuclear accidents, or radiation therapy. Carcinogenic chemicals. Asbestos. Linked to mesothelioma. Benzene. Formaldehyde. Pesticides and industrial solvents. Air pollution, especially particulate matter and diesel exhaust. 3. Biological and medical risk factors. Infections. HPV, cervical, anal, throat cancers. Hepatitis B and C. Liver cancer. H. pylori, stomach cancer. EBV, certain lymphomas. Chronic inflammation, from conditions like ulcerative colitis or Crohn's disease. Immunosuppression, due to HIV, organ transplants, or immunosuppressive drugs. 4. Genetic and hormonal factors. Family history of cancer, especially first-degree relatives. Inherited gene mutations, BRCA1/2, Lynch syndrome, etc. Hormone exposure. Estrogen, from early menstruation, late menopause, or hormone replacement therapy, increases breast and endometrial cancer risk. Testosterone therapy may slightly increase prostate cancer risk. 5. Age and gender. Age. Most cancers occur in people over 50. Gender. Some cancers are more prevalent in one gender, e.g., breast in women, prostate in men. Note: susceptibility and risk factors are closely related but not exactly the same. Here's how they differ. 1. Susceptibility. Definition: a person's inherent or underlying tendency to develop cancer. Nature: often biological or genetic, and sometimes not modifiable. Examples: inherited mutations, e.g., BRCA1, BRCA2. A family history of cancer. Weak immune system. Age or gender. Think of susceptibility as the baseline sensitivity of an individual to cancer. 2. Risk factors. Definition: any condition, behavior, or exposure that increases the likelihood of developing cancer. Nature can be modifiable, like smoking, diet, alcohol, or non-modifiable, like age or family history. Examples: smoking, UV exposure, obesity, exposure to carcinogens. Risk factors are more about what increases your chance of getting cancer. In summary, susceptibility is about your built-in vulnerability. Risk factors are external or internal influences that increase the chance of cancer, regardless of how susceptible